Welcome to Authentic Living with Roxanne, a place where we have conscious conversations about things that really matter in our lives. And now, here's your host, Roxanne Derhaj.
Hi, everyone. It's Roxanne Derhaj. Thanks for tuning in again this week with Authentic Living with Roxanne. Today, I'm privileged to have a colleague that has so many similarities in the field of mental health coming on today. Her name is Ronke Komolafe. Am I saying that wrong? So pronounce it properly.
Komolafe.
Komolafe. I like that's really pretty when you say it the way you say it. Komolafe, Ronke Komolafe. Ronke and I are both Forbes council members. I am the chair, and I was lucky enough. I think I met Ronke about 8 months ago now, when I believe she was already a member, and I was probably just beginning myself. So today, what we're going to talk about is mental health, and something that in my tenure, and obviously Ronke's tenure, we'll talk about. Ronke, I started out really young. And for the podcast listeners, they know that I learned quite young that voice was important to me. I grew up, in Trinidad and Tobago in a little, village called Diamond Village. And there was a lot of connection, and really, it was like the village was my family, over and above my family, but also in that I saw a lot of disconnection, some of it with my primary family. So I really, very, very early felt that need to be able to share what I was going through, and then decided, well, maybe when I grow up, I can maybe help others with that. And that really was where my path got started around mental health. Tell me about you. So a bit about your background. It's Dr. Ronke, I should tell you. And tell me about your path, which is in mental health, but a bit different from my path. What got you into, mental health as a specialty?
Oh, thank you so much, Roxanne. I appreciate you inviting me to your podcast. Thank you for this opportunity. In honesty, I've always wanted to be a psychologist, a clinical psychologist as a child. I had the picture of my company laid out by the time I was 12. I had a vision, and I was born and raised in Nigeria. And then I came to America when I was 20. So I had my freshman and sophomore years in Nigeria. And then in my junior year, I moved to Kentucky to go to University of Louisville in Louisville, Kentucky. And back then, I really just wanted to be a psychologist, but Nigeria never really had a psychology program in the schools I wanted to go to. So my dad convinced me to become a sociologist, which, it's really about the study of human behavior, very similar to psychology, but yet has a lot of differences. So as a sociology major, I was very fascinated with all my psych classes. They were very entertaining, easy. And I kept telling myself, somehow I'm going to end up being a psychologist. I don't know how. So I ended up coming to America in my junior year. I applied to change my major to psychology. I became a psych major. I was excited. I'm going to become a psychologist or a psychiatrist at this point. I changed my mind, or a neurosurgeon, something that has to do with the brain or human behavior, because I was just fascinated about the human behavior. And by the time I graduated, I was certain I wanted to become a psychiatrist. So after my graduation, I decided to become a case manager, working closely with psychologists, therapist, and psychiatrist in a mental health clinic. And as a case manager for a serious mental health clinic, you're the first line of communication before therapy or before the doctor. So I really, for almost 3 years, I really got to experience on a day-to-day basis what it means to be a psychiatrist, a psychologist, a therapist, pretty much any type of profession in mental health. And after that, I decided being a psychiatrist was not for me. However, I do like the operational aspect of medicine. So I decided, okay, I'm still going to go to medical school to become a neurosurgeon. I got in, I applied, I was admitted, and then I had to go shadow doctors before I actually started school. And this time around, it was different from a community health center. It was private settings, it was surgical centers, and I had to talk to students, go to classes. For almost 2 weeks, I was embedded in this process, and it was the most boring thing I have ever experienced. Different from psychology or psychiatrist, where you're continuously talking to people about what they're going through. This was very cut and dry. What do you need? What do you want? Let's get it done. And after that, I decided the most fascinating thing from my experience, both shadowing and working in a clinic, was really the operational side of healthcare. So I decided to finish my MBA, which I was doing my MBA then, and go get my PhD in behavioral health. So as a behavioral health expert, my focus is on integrating mental and physical health, because one of the things I saw was, for a chronic physical health condition, there's always typically an underlying social determinants of health issue or a mental health issue. And for a chronic mental health issue, there's typically an associated long-term physical health condition. So if you bring a schizophrenic, for example, if you're seeing them, they've been on the same medication for 10 to 20 years, the chances of them developing high blood pressure or diabetes as a result of their medication and their condition is very high and very likely. Same thing for somebody who has diabetes. If they don't know how to manage it properly and understand the symptoms, they can easily become depressed when they have low blood sugar, high blood sugar. Just depends on their levels. So I really saw the intricacies and the interconnection between mental and physical health, and nobody was talking about it back then. Nobody was associating that somebody who has financial problems, is homeless, and who has these conditions, it's not going to follow through. These were the experiences I had working in the clinic. So I decided, getting my PhD was in behavioral health with a focus on integrated health was the right way to go. And here I am today.
Well, it's interesting, right? So I started frontline with the Metro Toronto Police. And I thought I was here, I'm 21 years old. And I'm thinking, wow, this is real, right? And then realizing that it was the human condition and really understanding now in retrospect, 30 years later, recognizing that every interaction that I had with people would help me look at them holistically. And then not long into my corporate career, I was looking at health and wellness strategy about what would it take to keep people healthy and at work, healthy and potentially happy, so that we would intervene relatively quickly. And, quite soon, what was really, really apparent to me, Ronke, is that integrating or understanding the needs of the well employee that may step into starting to be unwell is a lot cheaper than when you catch them late stage into short term, when they're about to kind of do that cyclical door of the short term disability claim, where it becomes quite vicious. And then what is the right intervention to get them back on the path? So it's interesting how when I look at me starting at definitely frontline, and you wanting to go frontline and going, more of an integrated approach, I ended up at that end as well, because ultimately it's what is in people's best interest to be able to offer the ultimate solution would help them, get the best kind of support that they need to be healthy psychologically, emotionally, and biologically.
Yeah, I love the way you said it, because when it comes to well-being, a lot of people think eating healthy and being happy is the solution to well-being. But in reality, well-being really is a lifestyle, right? So telling people to exercise and eat healthy and sleep, those are great self-care tips. But people have to do it continuously, right? It's a lifestyle. And a lot of times, most of what we experience in terms of people having challenges at work or people having healthcare challenges comes from chronic conditions or trauma. It comes from a lot. When you do a detailed, comprehensive assessments to look at their physical and integrated health, you see an interconnection on why some of these things happened, right? Somebody with a chronic back pain due to an accident they had 20 years ago is physically having chronic condition and pain, right? But in reality, they're traumatized by that accident 20 years ago, which to them, they never needed therapy for. So that trauma continuously shows up as back pain and in other areas of their lives, not in all cases, but in some cases. And in some cases, it then spills into their work life and in their personal relationships, right? So a lot of times our mental health is a history of what we've gone through, either positive or negative, and the long and short-term effect that it's having on us. So I love that you touched on it when it comes to work. It's one thing to tell employees be resilient, go exercise. We're giving you an exercise benefit. We're giving you a therapy benefit. But I think in reality, it's asking the employees what they need to be okay.
Right. And, when we looked at the trending analysis, we looked at, I worked in every size and sector of company, multinationals from, 500 lives all the way up to, I think one of my biggest contracts was over 750 employees across North America. And ultimately what it was to understand what were the pressures, of that individual. What was these pressures of the environments that they were in, the type of sector that they were working with, their demographic variables, if it was a 24/7 service, all the things that and I know, and that ultimately we could map out if it was in healthcare, for instance, mostly female, generally nurses, 24/7. They're about 42 to 51 years old. They are either, shift work with children that they're raising, or maybe they're separated. So the strategies ended up being more kind of focused on what they were needing. But to your point, if we figure out what the core fundamental is for that person, then you're able to, versus, let's spray and pray. Let's put a nutrition program in. Let's put a gym membership. Those types of things are already really good. And for the people that you're offering that benefit, that's generally the people already using it. But it's the 20%. That's what we found. It was that within that 20%, and they weren't sick, and they weren't on. They were well enough, but they could kind of hide below the radar. So they were the ones showing up every day. They maybe giving you 65% of productivity, or presenteeism, like the term is. I'm going to show up, I'm going to give you my face time, but I'm not going to get the productivity. But those were the individuals that were generally using every benefit, and they were costing organizations the most. But you couldn't engage them based on those kind of, what I'm going to say, blanket benefits. It was always, how do we reach them? So I just want your perspective from integrated health. Does that make sense? What you see, it's reaching that band, and the 20% may be an erroneous number for this time in the marketplace. But what is it that you see with that subset, or what are you seeing now with reaching? I call them the unknowingly unwell.
I think that's a good way to put it, because first of all, when it comes to recognizing this, a lot of people don't easily recognize they're stressed out, right? They can physically feel it for 5 minutes, 10 minutes, or a whole day. And then 2 weeks later, they notice they have insomnia. They go to their doctor's office, they get medication for insomnia, boom, they stop waking up at 2 or 3 o'clock in the morning. And you and I know the pattern of waking up 2 or 3 o'clock in the morning continuously for at least 2 weeks. That signifies a level of stress, and in some cases, depression. Right? Mm-hmm. Without doing an assessment, we really can't say that. But we do know that's a pattern. That's part of the questions that we tend to ask if you're trying to screen. But if somebody has those symptoms and they go to the doctor and just say, I'm having insomnia, I'm stressed at work, the doctor asks them the basic, PHQ-9, everything seems okay based on how they answer it. They're getting a medication to sleep well. They think they're okay, right? But the progression continues. Mm-hmm. So in terms of how do we capture these individuals, my recommendation is we all need to own and be responsible for our well-being, right? I always tell people, do an integrated health assessment. How is your finances stressing you out? Because if your finances are stressing you out, it could cause more stress in your workplace where you become resentful that you're not making enough. Or maybe you're just spending more than you make. It's not really your employer. And that's when you really need to do a true assessment. Why are you upset at your employer? When you're making enough, you're just overspending. It could be a spiritual assessment, right? You may believe in a higher power, but you're not replenishing and growing in a higher spiritual way. It could be social. Do you have enough friends? Do you have enough support friends? I have friends who tell me, they're lonely, not because they don't have friends, but they don't have friends with friends who have kids within their age range, or they don't have friends who have the same occupational status and professional status with them, so they can't really have certain conversations with them. Or every time they're available to spend time with their friends have other engagements. So it could be a social issue. It could be a professional issue. How fulfilled and satisfied are you with your job? And it could be a mental health issue. It could be a previous trauma. It could be a current stress. We all know prolonged stress can lead to mental health conditions. So I think it would be great for employers to do continuous assessment. Give individuals these questions to continuously assess without even asking for a feedback. Because a lot of times there's a distrust. If I were to answer this truly, what are you going to do with my data?
Absolutely. They're afraid. They're like, it's performance evaluation time.
Yeah.
And, I know in the employee assistance world, everything's confidential. But then when disability programs, there was a point here in Canada where the providers started to offer both EAP and disability. So here we were in the EAP world where we were like, it's completely confidential. We don't break confidentiality, but then you have these bigger companies which have swallowed up a lot of the smaller companies, and they had arms now. They had the EAP arm, but now you have disability arm. Well, the disability arm, you have to give information to the disability provider about, what's keeping you away from work. So how then does the employee feel like, I can completely go to the psychologist or therapist and tell them everything. And I know unless I tell them about homicide, suicide, or child abuse, nothing gets broken. But on the other arm, now these bigger, companies, these multinationals are now saying, well, we also offer short-term disability, but we need this information because we need to know how long you're going to be off. What is the diagnosis? What is the treatment? And what steps are you taking? Blah, 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 blah. So people start to get confused, to your point, right? So making sense, because again, people are concerned about, well, this is my livelihood. And, I'm trusting and all, but how do I really know where that information goes? So how do, when you're working with environments from integrated health strategy, how do you approach that concern about trust and data?
That is an ongoing issue, in all honesty. One of the things that we've seen has been very successful is give individuals, in some cases, funding and tell them, hey, go subscribe to a certain mental health app. Let us know which one. So we know you are, and we can pay them directly. Another one could be have them do assessments and tell you what they need. Another one is just continuously build the trust and let them know you will never give away their data. You have to bring legal in, and have them sign some documents so it shows that it becomes some type of legal documents that the company technically cannot provide. Whatever you need to do to get their trust. Having monthly meetings, peer support groups within your companies, moms with kids less than 10-year-olds, dad with kids less than 20 years old, blended family support groups, burnout support groups, creating the support groups. We see a lot of mental health apps there. Most of them are great. Most of them do a fantastic job. There's still a trust issue where people feel if they complete the assessment, use that someday the company would get that. So it's almost, hey, we have a subscription, log in, we never get your information. You don't even have to use your real name if you choose not to. You can use the company code, but you don't have to use your real name. Whatever the company needs to do to help people be okay. And when it comes to well-being, like I said, it's a lifestyle. So you just don't do it once a year during employee assessment. We eat every day, right? That's for nourishment. We exercise, we need the sun, we speak, we drink, we sleep. We need those things to re-energize ourselves. It's a lifestyle. So is employee well-being. It should be a lifestyle for the company and a lifestyle for the employees, right? So continuously assess them on a monthly basis. What do you need? These are the 10 things we have. How is this working for you? Verbal, I'd say sometimes surveys should be done where employees can just do a Dropbox, or you give them a list of questions and it's typed out. They have to print it out anywhere they choose to manually fill it out and drop it in a Dropbox so you cannot trace it. Anything to create that level of trust. So, because when employees are okay, your productivity goes up. It's a win-win. When employees are fulfilled and happy at work, their productivity goes up, their presence at work goes up. It's not about showing up to work for an 8-10 hour job. It's about really giving us that 8 to 10 hours, right? Because you can show up. Your productivity might be an hour's worth, and you can show up for 8 hours, and your productivity is almost 12 hours worth because you're just on point. So when we truly take care of our employees, it's a win-win situation. And I think with COVID, a lot of companies are striving and doing everything they can to do that, in all honesty. It's just we need more communications from employees to tell us what they need. Before I started my own company, I remember going to my boss back in 2019, and I told him, I'm going to be burnt out. It's coming. I can feel it. I can see it. I don't like who I'm becoming. I'm cranky all the time. And I do all my lifestyle management. I exercise every day, meditation, yoga, writing my journal. I was doing all of those things. So I wasn't physically tired or really mentally tired, but I was no longer fulfilled at my job. I had outgrown that environment. And I told him, he's like, what can I do to help? And, I came back and I told him, take away all these responsibilities that you've been adding on the last 2 years. These are not areas of my expertise. I'm doing them because you've asked me to, but now it's causing me to burn out. I need to go back to doing what you hired me to do, my area of fulfillment and expertise, what truly makes me happy. And his response is, I'm the CEO and I'm making an executive decision. Then no, you have to continue doing what you do. And I said, okay. 2 weeks later, I came back and said, I have a job offer. I'm leaving October 2019. Unfortunately, I couldn't leave because we got acquired and he chose not to disclose that. But rather to tell them I was coming on board and I was written into the contract. And unfortunately, I had to stay with the company for 12 months. But they did not get what they deserved from me. I did not give them the level of productivity I should have given them because I was honest. But my boss then thought he needed me, and his communication was, I can get her to do whatever I need. She's very collaborative. I'm like, not at the expense of my health. So I think when we truly listen to our employees, we can give them what they need. One of the strategies I've used, which I haven't done in 7 months, in all honesty, but I will go back to doing that, was for almost 2.5 years after I left that company, I went on vacation every month. I took 6 days off live and I would go to the beach, travel to the Caribbean mostly, or to Europe, or sometimes I took a month off. But I would usually travel to the Caribbean, no internet, no computer, and just relax, come back, work hard for 3 weeks. And that was what I needed for 2.5 years for me to replenish, which was shocking because if you ever told me I would need that, I would have told you no. But I did an internal assessment and my exercise was still on point. Yoga was there, meditation, journaling, praying, everything else was there. My friends, my family. But I just needed a sense of disconnection from technology. After getting my PhD and being around computers all day for about, 16, 17 hours a day, reading or at work, I was tired of always having computer screens in front of me. I needed to disconnect. And that really helped energize me. For some people, it could be going camping. I've even done it where in my own house, I would turn off my internet for a week or for a few days and tell my family to call me on like iMessage. And it feels like a vacation. I never knew turning off your internet could really feel like you were on vacation.
Well, I think that's a great point. And, I think, having chose the field that I did quite young, um, that's what they don't teach you in grad school, first of all. They touch on how you take care of yourself. But it was something when I worked with the Metro Toronto Police, like I said, it was the first job that I had out of university. And what it showed me was that this, being my head, was the most important space, that I need to really, really listen to that space, because I was, when you're in crises, you're the first responder, you're first up. And at that point, I was part of a team that was the first responders dealing with the victims of crime. So oftentimes the crime had just occurred, the scene was barely cleaned up, and we were there on site to help the victims of crime. And of course, your body and your brain, Ronke, is wired for that. And I'm wired for that. I think you have to be a bit of adrenaline junkie to do a bit of what I did. But slowly what it started to show me was like, I would be on. And I worked probably 10 out of 31 days because they knew the impact on human beings. And then when we dealt with difficult cases, it literally took me sometimes 24 hours just to come back down. So you think about that cyclical element of, the human capacity. We are wired for short-term bouts of stress, but it's the prolonged effect, which is what you were describing, that at that point, you're trying to replenish by all the things that should give you that bump back. And you're just not being able to kind of find that timing again, because you need to just go, you've gotten so deep, with depletion, that it takes you a while just to be able to build back up. And I think finally, fortunately or unfortunately, with the pandemic, it has shown all of us, employees, leaders, CEOs, that we really need to start to listen to what people are needing when they say, I really, like when you went to what guts it took to be able to go and say, hey, I'm on the way. That now people are starting to say, those conversations we used to slight, we have to really, really take seriously, because people aren't able to just come back and bounce back like they used to, because they're depleted. A lot more people are depleted. Hence why we're seeing such a surge in anxiety and depression as well.
Yeah, and I want to touch on something that you said about the pandemic, which part of my role in healthcare is regulatory affairs, right? Assessing what the healthcare industry would look like from a regulatory perspective in a year, in 3 years, in 5 years, in 10 years, looking at bills and laws that have been put in place and the policies that need to be implemented, both on Medicare, Medicaid, and commercial basis, right? I think once the pandemic happened, in all reality, I remember as soon as the March 20th, I remember writing a memo and sending it to my marketing team. I'm like, hey, we need to get ready for telehealth. Medicare just said, services are shut down. They're recommending telehealth. This is going to go statewide, 50 states, get ready. And they're like, you don't know what you're talking about. I'm like, okay, it's part of my job. Another assessment I did, COVID is going to last until 2021. And they're like, what? I'm like, hey, from an economical perspective, we didn't just shut down the country. There was already a plan in motion. There were individuals who were experts who evaluated this. COVID and the impact of it would be, all the way until 2021 December. My analysis, I didn't even know it would go all the way to 2022, right? Like, so let's prepare what we are going to do from a healthcare perspective to be okay. Now, my third analysis, mental health. You shut people down, isolation, loneliness, one of the key reasons people have depression, people have mental health issues. We will see a surge in mental health conditions. Let's be prepared. And for myself, I texted all my friends. I have quite a few friends in mental health. And I said, mental health issues are going to be on the rise. What can we do as friends to support each other so we don't have that? And my friend is like, we just have to all quarantine together and improve our social lives and create a schedule.
Yes.
Right? We need to work out. We're all going to work from home. We know that. Grocery shopping, how do we handle that? And we developed a social schedule that everybody aligned to. I think during the lockdown, that was the most social I saw, the most social interaction I had with my friends, right? We were all available and we were all safe, right? Nobody was interacting outside of the group, so we knew we were safe. Nobody was going to get us in contact with COVID. But we did the assessment quick to ensure there was no, my fourth assessment was PTSD. Mm-hmm. People who did all of this will not only have mental health issues, but will have PTSD. And people who are mentally healthy may have PTSD and not really understand it's PTSD. Right. A lot of what I'm seeing right now in the workplace, and even with my colleagues and friends, is we call it the COVID PTSD. Mm-hmm. I get these calls every week. I would say at this point, maybe once or twice a month. It used to be every week, where I would have professionals, healthcare professionals, executives tell me, Ronke, I'm okay, but I'm not okay. I don't know what's going on.
This was such a great interview that we decided to turn it into a 2-part series. Be sure to tune in next week for part 2, so you don't miss out on the amazing content.
Thanks for tuning in to Authentic Living with Roxanne, creating the space for positive, healthy change. Roxanne is a keynote speaker, psychotherapist, and coach. To work with Roxanne, visit roxannederhaj.com/blueprint. We'll see you next time on Authentic Living with Roxanne.